My name is John Harding. I'm the president and CEO of the Florida Hospital Tampa Division, and it's just a delight. It's like a Chamber of Commerce day after the rain that we had yesterday, so we're delighted that the weather cooperated. Today we'd like to take time and share with you an exciting strategic partnership that will transform healthcare here in the Tampa Bay area. But before we do that, I would like Dr. Dick Tibbetts to come up and just share a brief devotion with us and have an invocation. He is our Vice President and Chief People Officer. So Dick, if you would please come up and share with us. Sure. Thank you.
Thank you. One of the treats I used to get as a child was to go and visit my grandparents. And on my grandfather's farm was a yoke that he had nailed up above the farm door. And it didn't look too appealing to me. I don't know if you've ever seen a wooden yoke, but it's a big, heavy piece of wood. And then on each end, they had a looping piece of wood that you could adjust up and down. And our farm was near New England, and so when I saw that, it kind of reminded me of the stockades that they would put people in when they were bad, you know? And you'd put your arms through those loops, they'd tighten them up, and you'd be right there carrying this yoke around all day because you misbehaved. Maybe my dad threatened to do that to me when I was young, I don't know. And I remember when my mom was trying to get me interested in church, she would read to me a scripture, take your cross upon you, and I think, well, I got to carry one piece of wood to be a Christian. And then it says, carry my yoke, for my burden is light, and I got to carry another piece of wood to be a Christian. I'm thinking, man, I'm hauling a lot of wood around here just to enter this religious interest of my mother. And so I remember talking to my grandfather about that yoke. And I said, Grandpa, what's it like to carry that yoke? And he kind of smiled and he said, I don't know, I've never carried it. And I said, well, what is it for? You know, we didn't grow up with yokes. And my grandfather told me how his father, so this really goes back several generations, how his father had 2 oxen and how they would take the yoke and place it on the oxen, and the 2 pieces that I saw that I thought he was going to strap my arms into actually helped balance that yoke on the shoulders of the oxen. And the purpose of the yoke was not to carry around a heavy piece of wood, but was to help lighten the load so that 2 oxen pulling together could do more than any oxen could possibly pull on their own. And I thought, what a nice imagery for our meeting together today. That 2 institutions right across the street from each other can do more pulling together than either can do on their own. And you know, in that context, Matthew started to make sense to me. Take my yoke, for my burden is easy when we pull together. Today we're going to hear some announcements about pulling together. And so before we go further in the program, I'd like to invite you to pray with me as we ask God's blessing upon this effort. Lord, thank you for a ministry, a mission, and a purpose to elevate healthcare, to extend Christ's ministry into this community, to partner with top-notch players so that together we can do more than any of us can do alone. Healthcare is complex today. The healthcare needs are great. We have a community that we're committed to serving. And so today, we're going to be sharing how 2 great organizations can make a difference in elevating the healthcare of this wonderful Tampa Bay community. So thank you for this time to hear what we can do to make a difference is our prayer in your name, Lord. Amen.
Thank you, Dick. When we announced our name change of September 2011, of last year, of course, we mentioned that we were working on strategic partnerships, including one with USF Health. Dr. Steve Klasko, CEO of USF Health, spoke at our name change announcement about the exciting opportunity to be affiliated with a hospital close to their campus, in fact, just right across the street, and the endless possibilities an affiliation could hold given our similar and aligned missions. We're fortunate to have him supporting this partnership that Florida Hospital and USF is embarking on today. Today, we're announcing a more comprehensive strategic alliance and a partnership between Florida Hospital and USF Health in 4 key specialties: cardiology, breast health, neurology, and cancer care. We believe this is an important part of fulfilling the commitment of elevating health care in Tampa Bay. Now, it is my distinct pleasure to introduce Tampa's mayor, Bob Buckhorn. He's been in office not even a full year, and Mayor Buckhorn has catalyzed an energy and an entrepreneurial spirit that is absolutely tangible. I'm sorry. All right. Come on up. There's just a little bit more. He's been expanding business development to community and downtown revitalization. This city's already seeing results. So please welcome me to Tampa's can-do mayor, Bob Buckhorn, who will share a few words on how a strategic value of a partnership like this can be in Tampa Bay. Thank you, Mayor.
Thank you. I can't tell you how excited I am to be here and to see all of you here. I don't know about you, but I can sense that there has been a rebirth in this community. I mean, I don't know about you, but I can sense that optimism. I can sense that can-do spirit. I can sense that belief that we are a city of destiny. And that at the end of this period of time, they will say about us, this is where Tampa found its voice. This is where Tampa planted its roots. And there are partnerships like this that make a difference. Because I will tell you, we will either succeed together or we will fail alone. This relationship, this expertise, this involvement tells me that we have turned a new chapter in our history. Because I can tell you, changing Tampa's economic DNA, changing this from a community that was settling for anything, not aspiring for greatness. This is our time. This partnership is going to make a difference. Because ultimately, we as a city have an obligation to leave this place in better shape than it was given to us. My 2 little girls, if I want them to come home here someday, we've got to change the way we do business. We've got to start to create those value-added kinds of jobs that will allow young people to come home, allow us to keep our best and brightest, allow us to focus on the world-class research that takes place at USF, the world-class patient care that takes place at this institution. But more importantly, it sends a signal about who we are and where we're going as a community. This is our time, ladies and gentlemen. This is our destiny. It is partnerships like this and the realization that we've got to put aside those old parochial boundaries. We've got to put aside our differences. We're not fighting about whether we're Democrats or Republicans or whether we're blue or red or whether we're city or county, because we are all in this together. All of us. And for us to compete with the Charlottes and the Atlantas and the Raleigh-Durhams and the San Diegos require that we are on the same page, pulling at that same rope, believing in our ability to be that great American city. It's our turn. There was a time when everyone talked about Tampa, Florida. There was a time when everyone wanted to be a part of this. It's now our turn to get back on track and make sure that we turn over a city to our kids that reflects the greatness that is embodied in this community. Thank you for putting aside the differences. Thank you for believing that we are all in this together. Thank you for understanding that it's our turn. Let's get it done.
Thank you, Mayor. Appreciate that. Commissioner Merman has a long history of public service. She's a former legislator and Speaker Pro Tem and is currently Vice Chair of Hillsborough County Board. With a passion for children's health and well-being and a focus on economic development, she is unarguably one of the hardest working elected officials in this region. Please help me welcome Commissioner Sandy Merman.
Thank you so much, Mr. Harding. I absolutely do not like following Bob because he gets up here, he's all excited, cheerleader, go get him, has the vision, the strategy, and then I have to come in as the boring old coach and say, okay, let's get to work. So anyway, my neighbor too. But anyway, no, I'm so excited that actually we're working together. Every day we are coming up with a new idea to work together on. So today is fitting for the city and county to both be here and congratulate Florida Hospital and USF, Dr. Dean Klasko. Just, it's exciting. You know, I did spend quite a few years in Tallahassee, and my specialty was healthcare and the healthcare budget. Actually helped get the new med school going and nursing school over at the university. So I see the importance, and I kept waiting for something to happen, some big collaboration, because I knew about Florida Hospital. I've known about them for a long time because I knew about them in the legislature. And when they came in here 6 months ago, wow, I didn't know you could do all this in 6 months. So it's great. And I congratulate you and thank you so much, because this is what will make our community so great. But more importantly, it's going to bring jobs. It's going to bring jobs, economic development, two things that we really need here in this community to really get people's confidence back, that we are going to be the great region that everybody has talked about for so long. So I thank you. I thank you from Hillsborough County. I send messages from all of our county commissioners. I see Mark Sharp out here. Please, and Mark has been a great partner already in getting these great collaborations together, and I think we're going to see more, Mark, aren't we? But no, I'm a big supporter, and I hope that this, and I know it will go very well and get a good start. Actually, my son-in-law is coming back here in cardiac. Maybe we can get a job.
Was that a request? Thank you, Sandy, so much. We appreciate it. I met with you a couple of weeks ago, and it was such a delight, and I appreciate your enthusiasm. At this time, I'd also like to thank key community leaders in their region for the positive support that they have given us to date. U.S. Representative Clint Shoup, are you here? All right, just raise your hand. He's representing, thank you. Gus Bilirakis, our U.S. Representative, so thank you for being here. In Hillsborough County, Sandy Merman, thank you. Mark Sharp, appreciate you being here today. Mayor Bob Buckhorn, thank you so much for being here. Lisa Monteleone, are you here? Thank you so much. Sure, here you are in the front row. Allison Fernandez from Temple Terrace City Council, are you here? All right. And Mary Jane Neal from Temple Terrace City Council. Pat, here you are. Hi. Pat Mallory, Pasco County Commissioner. I know I've seen you. Thank you. And some of our regional health representative, Deborah Zorn from Hillsborough County Medical Association of Executive Director. Are you here? Thank you. David Johnson, Director of the Pasco County Health Department. Thank you for being here today. And from our Chamber and Economic Development, Bob Rohrlach, he Jr., Tampa Chamber of Commerce CEO. And Barbara Sparks McGlinchey, Temple Terrace Chamber of Commerce Executive Director. Very good. Thank you for being here. and John Hagan Pasco, EDC President and CEO. Very good. Good to see you. Thank you. And I was going to introduce to you Dr. Judy Genshaft. If you notice, she was here at the beginning, but she had a prior speaking engagement. But that lady is amazing. She wasn't going to miss this for anything, so she did show up for a few minutes, but had to make a fast getaway. So she sends her congratulations, and we're delighted that she could spend a few minutes with us again. Once again, thank you for your support, as you've made us feel welcome in the short time period that we've been here in the Tampa market. While some of you already know us, others may not be as familiar with us. So as way of a little bit of background, or maybe just a little tutorial, Florida Hospital, and this is our main hospital in Orlando, is considered the flagship of Adventist Health Systems. Our humble beginnings started over 100 years ago when our first hospital was founded as a small 20-bed cottage on the shore of Lake Estelle in Orlando. Today, Florida Hospital has 22 hospitals across the state, including 7 right here in the Tampa Bay area. At this time, I would like to invite Michael Schultz, CEO for the Florida region of Adventist Health Systems. Mike will share some thoughts on his involvement in the strategic partnership that we're talking about today, how it developed, and how it will help elevate healthcare across Tampa Bay. So Mike, at this point, it's my delight and pleasure to ask you to come to the podium to share a few words.
Good morning. I feel like I'm in church. Had an invocational by Dick, and I have the choir behind me. So it's a good day. First of all, I want to just thank all of you for participating and sharing this event with us. This is a particularly good day for me because I have from day one said, on numerous occasions to anyone who would listen to me, that the key critical success factor in Florida Hospital entering the Tampa Bay healthcare market back in 2010 was the ability to take advantage of our opportunity to partner with USF. It's 3 years in the making, but it's what we're announcing today, a partnership. Dr. Klasko and I started meeting way back in 2009, about a year before the actual merger between Adventist Health System and University Community Health occurred. The conversation was never, could we or should we do something together, but how do we come together and transform the way healthcare is delivered in Tampa Bay? Now, I would be remiss to not mention a couple of individuals who made this happen. It's one thing to come up with an idea and strategy. It's another thing to operationalize the strategy and make it happen. And those individuals are Bruce Burgum, the CEO of Helen Ellis in Tarpon Springs, Doug Duffield, the president and CEO of Zephyr Hills, and Bridget Shaw, COO of the Pep and Heart Institute, and certainly John Harding, who is responsible for this whole region, making sure this happens. So it's a labor that occurred after hard work. So Dr. Klasko, it's official. We're no longer just neighbors. So what exactly are we announcing? I believe this. One of the nation's most innovative healthcare systems, Florida hospitals, even if I do say so myself, and certainly one of the nation's leading research universities and medical schools, USF, have come together to broaden access to the most advanced medical therapies, which are all designed to produce better patient outcomes. Well, how is this going to happen, you might ask? I believe 2 significant ways. One, new and expanded access to USF's world-class physicians in key specialties at our 7 Florida hospital locations for cancer care, cardiology, breast health, and neuroscience, for starters. Secondly, bringing USF's cutting-edge medical research closer to the patient throughout the Tampa Bay region, which includes Zephyr Hills, Tarpon Springs, and soon Wesley Chapel. The partnership begins to lay the groundwork for a broader scope of coordinated care in Tampa Bay between a multi-hospital provider and an academic-based research entity. The end result, Florida Hospital and USF will be able to offer the latest medical expertise in key specialties for both in and out patients. The really good news is that this is only the beginning. Much more is planned and further announcements will be forthcoming. I am confident the Tampa Bay communities will come to trust the healthcare services that Florida Hospital and USF Health provide now and in the future. Thank you very much. Dr. Plasko, please.
Well, some of you know I'm an obstetrician, and I've been here for 7 years. I can truly tell you that this union is both the longest gestation and longest birth I've ever been part of. But like any baby, it is worth the pain that we went through to get there. And probably 3 people worth just bringing out that might give you a little bit of the scope of this. And what this really means and how we got here. One is Tom Pepin. Probably within the first few months that I came here, Tom came to me and said, I don't understand. I'm not a doctor. I don't understand all the politics of this, but there's this hospital across the street from you. I've heard great things about what you're doing, USF. I know there's some great doctors. Am I missing something? Like, why can't we get together and make this into the most amazing cardiovascular community? And I said, boy, that's the most common sense thing I've heard in 35 years, and it comes from a guy that is the CEO of a beer distributor. There's something wrong in healthcare. Probably the second person to point out that says what this is all about, Sarah Ewan, are you here? Sarah is our new chair of molecular physiology and pharmacology that we recruited after a national search. And a good part of the reason that she came here, she's a cardiovascular and trauma surgeon who actually has become an NIH-funded researcher looking at microvascularization of the heart. And the ability to really start to translate those into real-life, life-saving mechanisms is what this is all about. But the real one that typifies how unlikely a union this was, and it's perfect that it's coming on the day that USF got into the NCAA men's basketball tournament. Go Bulls. My good friend Brad Bernstein. Could you stand up, Brad? Brad is the Chief Medical Officer of Florida Hospital Tampa. Just keep standing for a second. If somebody asked me which one was more unlikely, USF getting into the NCAA men's basketball tournament or the Chief Medical Officer of Florida Hospital Tampa wearing a USF tie, that would have been a pretty close thing. But as it turns out, you could have done very well looking at both of those. So here's what this is really about. Healthcare is undergoing a transformation, and despite our best efforts, for example, more people die of heart disease than any other cause in Florida. At USF Health, we're actually helping to lead that revolution by using a person's own genes to determine how to keep them healthy. My good friend Mark Sharp and the rest of the county had an opportunity to start working with us, and I'm proud to say that we now hired, as of Friday, probably the top guy in the country that's looking at these molecular genomics and actually translating them into real life now treatments for patients. Our chair of cardiovascular sciences came down here from Georgetown, Dr. Les Miller, to apply these kind of life-saving treatments. He had done some of the seminal work on why African American patients don't respond to the same amount of medications or the same types of medications based on some of the molecular genomics, and has saved countless lives. Our partnership with Pepin Heart Hospital gives us a partner who wants to help apply that life-saving research to patients throughout the region. Let's take women's health. That's the area that I'm passionate about. When I got here, I was on a governor's task force. The average amount of time between the time a patient got a mammogram and got the results was 7 days in this state. My good friend Charlie Cox, who's just a fantastic surgeon and breast health and women's health advocate, said, that's crazy, Steve. We can do better. We should guarantee same-day results. When we said we could guarantee same-day results, everybody said we were nuts. We did it over at the Marsani Center. It's been fantastic. And Mayor, that's the kind of thing, and Commissioner, that's the kind of thing that does elevate it. Because it's not only us. Now every private radiology group guarantees same-day results. And countless people have stayed alive. But now partnering with Florida Hospital allows us to expand that capability to provide life-saving surgery and radiation so that you have the best chance of a full recovery. A great research university partnership. For Floridians who do not live near an academic medical center in Gainesville, Miami, or Tampa, there used to be a choice. And it was a tough choice for families. Do I travel to one of those places for specialized care, or do I stay close to home where I have my family and support systems? For those living in Tarpon Springs or Zephyr Hills, starting today, that choice is history in these specialized areas. USF Health brings its nationally recognized specialty neuroscience capabilities to Florida Hospital Zephyr Hills, and our research and specialized surgery to the Helen Ellis facility. And I just want to acknowledge Dr. Van Loveren, who is our chair of neurosurgery, and Dr. Rankin back there, who is leading the surgical effort. So at USF Health, we don't believe in healthcare reform. We're trying to lead healthcare transformation, and that healthcare transformation is going to require academic medical centers. Mayor, every one of those communities that's leading in health that you mentioned, San Diego, Atlanta, Philadelphia, Charlotte, all have leading academic medical centers, and we believe that with this new relationship and the other relationships we have, we can do better than all of them. And I think in the past we've always talked about this hospital or that hospital. We recognize that it takes a team and a very coordinated approach to really make our families healthier. 40 years ago, this community came together and started a medical school. And combined with the nursing college, the public health college, and now a spectacular new pharmacy college in Tampa, hi Kevin, we are repaying that investment by making our communities healthier. The groundbreaking research we do in heart disease, neuroscience, diabetes, and women's health will allow you and your family to live longer, healthier, and happier lives. The new doctors, nurses, public health professionals, pharmacists, and rehabilitation therapists will make sure that we have a vibrant, caring team of professionals taking care of you in the Tampa Bay area. And along with our other partners in Tampa Bay and throughout the state, this new partnership with our Florida hospital system colleagues will enable more families to get the best of both worlds. The best an academic medical center has to offer at the best place to stay healthy, which is close to home. I am very, very proud of our new friends and partners, and I think this is going to be a fantastic thing for Tampa Bay. I want to thank my great boss, Judy Genshaft, and the Board of Trustees of USF Health, some of whom are here, who said from the very beginning when I got here 7 years from now, Steve, no limits. And that's why I came down to Tampa Bay, because there are no limits. We will be the best healthcare community in the country and the world. Thank you very much.
Thank you, Mike. Mike, as you may or may not know, is my boss, and he came in with a vision as we walked into Tampa, and it's just a delight to be a part of that. And also, Dr. Klasko, thank you so much for your comments. I would like to recognize at this time the following individuals who are on stage with me as they represent the leadership that made this partnership possible. As I call each specialty, we're going to do this so we don't go through every single name, or we'll be here for a good part of the day. As we read your name by specialty, if you would stand, both the physicians and the folk that are with USF and hospital executives up here to be recognized. The cardiology affiliation at Florida Hospital Pep and Heart Institute. Our breast health affiliation at Florida Hospital Tampa. Our neuroscience affiliation at Florida Hospital Zephyr Hills. And our surgical oncology, melanoma, and breast cancer affiliation at Helen Ellis Memorial Hospital. Thank you all for your dedication and for demonstrating an exemplary leadership role in this innovative and important partnership.
5, 4, 3, 2, 1.